So I'll talk a little bit about collecting other diseases. You do, as I've talked to other FHMers, we all seem to have some common diseases between us, and we seem to be collecting other things along the way. So I'm just going to give you a list of mine. This is by no means that you're going to get them, or that it can be entirely different for you. Whatever happens for you can be completely different than what happens to the next person. But along the way in my life, I've had ovarian cysts, endometriosis. I have a low thyroid that I take medication for. I have asthma that I take medication for. I have fibromyalgia that has gone untreated because everything that I could use to treat it with seems to conflict with the medication that I'm on. So that's pretty much untreated. I do test positive for lupus. I've never had any organs attacked, but I do test positive for it now. There does seem to be some anecdotal evidence that you're going to have some kind of like immunity issues along with this disease. So people tend to get fibromyalgia or rheumatoid arthritis or different kinds of immune deficiency diseases. So, and I also have another genetic disease called renal medullary pyramids. That is where my kidneys act like a sponge and they don't get rid of things properly. So I drink lots of water. I drink mostly water, and that's about it. So you will tend to collect other diseases. It's important to learn how to identify the symptoms of other diseases as opposed to what's going on with FHM, and kind of try to get yourself worked out with all the things that are kind of going on with you. Realize that these are, again, all affecting your biochemistry, and biochemistry, anything that affects biochemistry, and especially oxygen intake and the lungs, can really affect a lot of different things. Go ahead and learn about biochemistry and learn about how that's affecting you. Learn about what's normal. I actually was sent to a pulmonologist, and they kind of told me what was going on with my lungs and what wasn't happening and what was. So be prepared to learn a lot about your disease, and you'll end up knowing more about your disease than your doctors sometimes.